Here with Dr. Erica from St. Vincent Healthcare, and we're talking about atrial fibrillation, and that's because September is Atrial Fibrillation Month, and I'm saying it right. I'm so proud of myself. But let us know, what is atrial fibrillation?
So atrial fibrillation, or AFib, may be easier, is an abnormal heart rhythm. So the way the heart normally works, you've got the four chambers of the heart. You've got the atria, which are the two top chambers, and then the ventricles, which are the bottom chambers. And when the heart is beating normally, the atria squeeze, and then the ventricles squeeze. Well, in atrial fibrillation, the atria are kind of doing their own thing. So they're going irregularly, and they're kind of fibrillating and beating a little bit and not beating a little bit and pushing the blood into the bottom of the heart irregularly, and the bottom of the heart's trying to keep up. So it leaves you with an irregular heartbeat. So instead of the normal, heart rhythm that you have, you may have a kind of irregular heartbeat. So some people may feel that palpitation. Some people don't feel it at all. It can go fast, or it can be at a normal rate. But the thing that's important about atrial fibrillation and about diagnosing it is that it increases your risk of stroke. So if you have atrial fibrillation, you have about a 5-time increased risk of stroke than someone without atrial fibrillation, and that's why it's important. Now, not all fast heart rates or all necessarily irregular heart rates are necessarily atrial fibrillation. So it's important to track that and talk to your physician, your provider about that, and they can look and see further if you have atrial fibrillation.
And so what are some of the symptoms? Because you just mentioned some people feel it, some people don't. How do they know if it's a concern?
Well, if it's going fast and irregular, a lot of times people may feel lightheaded, or they'll feel short of breath, or they may even have some chest pain. And if that's the case and they feel their heart going fast, they need to go to an emergency room to be evaluated and get that heart rate down, because you don't want to put that extra stress on the heart, or you don't want it to go so far that they actually pass out or something like that. Some people don't have any symptoms at all. But people who are most at risk for atrial fibrillation, although anyone can really get it, it's primarily going to be in people who have high blood pressure, people with diabetes, people with underlying heart disease, but it's also seen a lot in people with obstructive sleep apnea. So you hear people with sleep apnea, and that puts an extra stress on the heart that can increase their risk for atrial fibrillation as well. Overtreated or overactive thyroid can sometimes cause people to go into atrial fibrillation.
Gotcha. And the good news is there are some treatment options.
Absolutely. So number one, we need to identify it. So you just need to be aware of your health, talk to your physician about it. Diagnosing it also would be with an EKG in the doctor's office, or with a heart monitor that you would wear for a couple days to see if you can pick it up, because your heart can go in and out of it also. You may be normal for a while and go into atrial fibrillation. But treating the underlying causes, number one, getting your blood pressure under control, making sure your heart's getting enough blood, making sure your thyroid's under control, getting on a CPAP machine if you have sleep apnea. And then secondly is talking with your doctor about your specific risk score with atrial fibrillation. And if you have a couple of those risk factors, you are going to benefit from being on a blood thinner. And that is, people talk about Coumadin, but we also have a lot of newer medications out that don't require all of the monitoring that Coumadin does. And that is going to decrease your risk dramatically for having a stroke if you have atrial fibrillation. So definitely important to diagnose and get treated and decrease your risk of stroke and other complications.
No room to play around there. Dr. Erica, thank you so much. I appreciate it. And we'll be right back after this break.